Hello, my dear students. My name is Sachin Jadhav, founder Fundamental Pharmacy, author of Fundamentals of GPAT Niper DI Pharmacist Volume 1, GPAT Cracker Actual MCQ book. Welcomes you in this YouTube video session. Students, if you are new on our channel, please subscribe the channel and press the bell icon so that you will never miss any video. My dear students, in this video we are going to see pinpoints regarding the pharmacology, because this pharmacology is very important for your GPAT Niper DI and pharmacist exams, and particularly if you are preparing for GPAT Niper 2023, then this video is going to be very useful, knowledge oriented to you, and it's my request to you, please watch this video until end. Friends, we have already seen pinpoints regarding the pharmacognosy. Also we have completed 5 videos on pharmacognosy. We have already seen one video on pharmacology, so please go and watch those videos also. So in this video we are going to see in continuation with the previous video. In the last session we have seen the biotransformation, different method, different phases of biotransformation. We have seen the what is biotransformation, what is the main aim of biotransformation, what is the outcome of biotransformation, what are the different phases of biotransformation. Now in this session we will see examples of metabolic reaction with respect to drug undergoing the biotransformation. So phase first is nothing but the known as a non-synthetic reactions. Phase first reaction, they are known as a non-synthetic reactions. So in this phase first reaction, oxidation, reduction and hydrolysis. So out of this, remember one thing over here, the most common phase first reaction is nothing but the oxidation. Most common phase first reaction is nothing but the oxidation. So what are the drugs which will undergo oxidation reaction? So phenytoin, diazepam, ibuprofen, amphetamine, chlorpromazine, dapsone. These drugs will undergo oxidation reaction in the phase first. Chloramphenicol, halothane, these drugs will be undergo reduction reaction. Then pethidine, procaine, these will undergo hydrolysis. Okay. So remember one thing over here, those drugs which are having ester linkage, they will undergo hydrolysis reaction. Now in the phase second reaction, they are known as a conjugation reaction or synthetic reaction. So in that you have glucouronide conjugation, acetylation, methylation and glutathione conjugation. So remember, phase second, most common phase second reaction is the glucouronide conjugation is the most common phase second. Oxidation is the most common phase first. Now this chloramphenicol, morphine, these and few other drugs will undergo glucouronide conjugation. Sulfonamides, isoniazide, this will undergo acetylation reaction. Adrenaline, histamine and other amines will undergo methylation reaction. Paracetamol is an example that is detoxified by glutathione conjugation. Okay, and that's why in case of paracetamol overdose, glutathione storage of body is depleted and you have to replace it by using N-acetylcysteine, which is a specific antidote for paracetamol. Or you can increase the glutathione storage of body by using sulfur containing amino acid, like for example methionine. So methionine and N-acetylcysteine both are the specific antidote for paracetamol overdose. Remember. Now we'll see the next point. So these metabolizing enzyme. So those enzymes which are involved in the drug metabolism, they are of cytochrome origin. We have seen in the last session. Okay. So most of the drugs are metabolized by, remember, most of the drugs they are metabolized by CYP3A4. Okay. Most of the drugs are metabolized by cytochrome enzyme CYP3A4 divided by pi. CYP, most of the drugs are metabolized by enzyme CYP3A4/pi. Most of the drugs are metabolized by this enzyme CYP3A4/pi. Remember, this was question in GPAT 2019. Now we'll see the different enzymes which are involved in the metabolism. So microsomal enzymes and their contribution in the metabolism. Okay, इसके ऊपर already question आ चुका है कि जैसे most of the drugs are metabolized by CYP3A4/pi. CYP3A4/pi. यहाँ पे different list है, different cytochrome P450 isoenzymes and their contribution in the metabolism. So we have seen that CYP enzyme, cytochrome P450 enzyme, they have named because these enzymes will absorb the UV radiation. They will have absorption maxima at 450 nanometer. That's why they are given the name cytochrome P450. Okay, they have different isoenzymes in their family. Okay, so remember over here CYP3A4/5, they will metabolize 36% of the drug. So if you have 100%, if you consider 100% metabolism, so out of 100%, 36% metabolism will be carried out by this CYP3A4/5. After that, CYP2D6, CYP2D6. This will metabolize 19%. Means its contribution in the metabolism is 19%. CYP3A4/5, that is a 36%. After that, CYP2C9/9, it will metabolize 16%. After that, CYP1A2 will metabolize 11%. It will have 11% contribution in the metabolism. After that, CYP2C19, it will have 8% contribution in the metabolism. Then CYP2E1 will have 4% contribution in the metabolism. CYP2A6 will have 3% contribution in the metabolism, and CYP2B6 will have 3% contribution in the metabolism. So remember, most of the drugs, they are metabolized by CYP3A4/5, because it will have 36% contribution in the metabolism, highest contribution in the metabolism. So that's why इसका सबसे ज़्यादा contribution होता है metabolism में, and that's why question आया था GPAT 2019 में. Most of the drugs are metabolized by one of the following isoenzyme of cytochrome P4. उसका आंसर था CYP3A4/5. Now we'll see the next point again. Enzyme inducers means what? Enzyme inhibitors means what? So those drugs which will increase the concentration of enzyme, those drugs which will increase the concentration of metabolizing enzyme, they are known as an enzyme inducer. Those drugs which will decrease the concentration of enzyme required for metabolism, they are known as enzyme inhibitors. So if enzyme inducer and another drug is given together, so it will accelerate the metabolism of another drug. If enzyme inducer and other drug is given, the metabolism of other drug will be increased. If enzyme inhibitor and another drug is given, so it will decrease the metabolism of another drug because of enzyme inhibition and enzyme induction. So this is the phenomena. Enzyme inducer means they will increase the concentration of enzyme required for metabolism. Enzyme inhibitor means they will decrease the concentration of enzyme required for metabolism. Now we'll see, because of this enzyme induction and enzyme inhibition, there is a metabolic interaction. There is a metabolism interaction. जैसे होता है ड्रग इंटरेक्शन, एब्सॉर्प्शन इंटरेक्शन होते हैं, डिस्ट्रीब्यूशन इंटरेक्शन होते हैं, सो मेटाबॉलिज्म इंटरेक्शन होते हैं, उसके जैसे एलिमिनेशन इंटरेक्शन भी होते हैं. सो हियर विल सी ड्रग इंड्यूस्ड एक्सेलरेशन ऑफ मेटाबॉलिज्म ऑफ ड्रग. तो यहाँ पे मैंने देखो, यहाँ पे एक टेबल लिखा है यहाँ पे. सो इंड्यूसर ड्रग मीन्स दिस ड्रग विल इंड्यूस द microsomal enzymes, means they will increase the concentration of microsomal enzymes, and that's why they will increase the metabolism of these drugs. Okay, so inducer drugs means it will induce the enzyme, and victim drugs means their metabolism will be increased. So barbiturate is an enzyme inducer drug. It will induce the enzyme and will accelerate the metabolism, will increase the metabolism of barbiturates, anticoagulants, steroid, oral contraceptives, vitamin D, vitamin K, thyroxine, phenylbutazone, phenytoin, grizofulvin, clompenicol, and theophylline. So these drugs are nothing but the victim drug. Normally इनका metabolism होने की जो speed है वो increase हो जाएगी because of this barbiturate, because it is an inducer drug. Likewise, phenytoin will increase the metabolism of glucocorticoids, vitamin D, and theophylline. Grizofulvin will increase the metabolism of warfarin. Rifampicin will increase the metabolism of oral contraceptive, glucocorticoids, and metoprolol. Carbamazepine will increase the metabolism of vitamin D. Then again, diclofenac and gamma-benzyl hydrochloride, they are also powerful macrosomal enzyme inducer. Nicotine is also a powerful enzyme inducer. So nicotine क्या है? Powerful enzyme inducer है. There was one question: smoking induces the metabolism enzyme. So nicotine is a powerful enzyme inducer. So cigarette smoking क्या करते हैं? Cigarette smoking induces the enzyme. Cigarette smoking is an enzyme inducer. Remember, it will increase the metabolism of drug currently used. Remember this. Then again, drug induced inhibition of metabolism of drug. तो मतलब जो drug enzyme inhibitors हैं, साइटो मेटाबोलाइजिंग एंजाइम जो है enzyme inducers देखा है अभी, enzyme inhibitors. So those drug which will decrease the concentration of drug metabolizing enzyme. Okay, so inhibitor means these drug will decrease the concentration of enzyme required for metabolism. So अगर concentration कम करेंगे तो दूसरे ड्रग का मेटाबॉलिज्म क्या करेंगे, डिले करेंगे. अगर ये ड्रग मेटाबॉलिज्म करने वाले एंजाइम को इनहिबिट करेंगे तो बाकी ड्रग का मेटाबॉलिज्म होगा नहीं जल्दी. ओके, सो दीज आर नथिंग बट द इनहिबिटर्स एंड it is a list of 15 drugs. So first one is allopurinol. Allopurinol will decrease the metabolism of tolbutamide, methotrexate, probenecid. Disulfiram will decrease the metabolism of alcohol, tolbutamide, warfarin, and so disulfiram is a drug used in the alcohol abuse, alcohol addiction. Disulfiram is a aldehyde dehydrogenase inhibitor. Remember, aldehyde dehydrogenase inhibitor is also known as anti-abuse. Then isoniazid will decrease the metabolism of these drugs. It will decrease the metabolism of glucocorticoid, contraceptives, carbamazepine, phenidone. Chlorpheniramine will decrease the metabolism of tolbutamide and probenecid. Cimetidine is an enzyme inhibitor and that will decrease the metabolism of warfarin and diazepam. Fluoxetine is a selective serotonin reuptake inhibitor used in the depression. Okay, it is an antidepressant. It will decrease the metabolism of warfarin, benzodiazepine, phenidone. Again, erythromycin is a macrolide antibiotic. It will decrease the metabolism of amiodarone, digoxin, antipsychotic drug, warfarin and theophylline. Ketoconazole is a powerful enzyme inhibitor. इसके बारे में क्वेश्चन पूछा है already. It is an enzyme inhibitor. So it will decrease the metabolism of cyclosporine, astamazole and terfenadine. Phenylbutazone is again enzyme inhibitor. It will decrease the metabolism of phenytoin and tolbutamide. Ethanol is an enzyme inhibitor and it will decrease the metabolism of methanol. It will decrease the metabolism of methanol. That's why ethanol is used in case of methanol poisoning due to competitive inhibition. Then valproate again is an enzyme inhibitor and it will decrease the metabolism of lamotrigine. Grapefruit juice. Okay, grapefruit juice contains one chemical known as solanine. It is also again a powerful enzyme inhibitor and that's why it will decrease the metabolism of cyclosporine, terfenadine, calcium channel blockers. Okay, so अगर कोई एंजाइम इंड्यूसर है तो वो दूसरे ड्रग का मेटाबॉलिज्म इंक्रीज करेगा, एक्सेलरेट करेगा. कोई एंजाइम इनहिबिटर है तो वो दूसरे ड्रग का मेटाबॉलिज्म इनहिबिट करेगा, कम करेगा. सो दैट्स व्हाई. सो अगर एंजाइम इंड्यूसर आपने दिया है और दूसरे ड्रग का ट्रीटमेंट चालू है तो दूसरे ड्रग का डोज आपको बढ़ाना पड़ेगा बिकॉज ऑफ एक्सेलरेटेड मेटाबॉलिज्म. अगर कोई इनहिबिटर ड्रग दिया है और उसके साथ में दूसरा ड्रग दिया है आपने, क्या करेगा, करना पड़ेगा आपको दूसरे ड्रग का डोज कम करना पड़ेगा क्योंकि ये एंजाइम इनहिबिटर के साथ में ले रहे हैं तो मेटाबॉलिज्म उसका डिक्रीज हो जाएगा. इफ यू वांट such kind of full lectures you can join our GPAT Niper 2023 online batch. There you will have live lectures on Wednesday, Saturday, Sunday. Recorded lectures will be available in our application. Study material will be provided in the form of hard copy at your doorstep. Online test series will be also available, all included in the 8,000 rupees. We have very much promising result in past few years. Thank you very much for listening me.